Today's guest is Dr. Amy Robbins. She's a clinical psychologist and a spiritual intuitive who believes that our connection to the divine and what she calls space in between isn't something to fear, but to explore. Through her acclaimed podcast, Life, Death, and the Space Between, Amy helps people navigate loss, awaken their intuition, and understand the deeper meaning of life. In today's episode, we will talk about all the things, especially what it means to live without awareness of death as a teacher, and how spirituality and psychology can coexist, and why listening to our inner wisdom can change the way we show up in the world. Now you see why I asked Amy to be my guest today. So, I want to get started with Amy, but before we get to that, I also want to say if you're a therapist, you will want to listen until the end because Amy has a new course that I know you will love. So, Amy, I'm so excited to chat with you today. How are you doing?
I'm great. Thank you so much for that introduction. I'm so excited to finally talk to you.
Yes, and there's always divine timing. I We've been trying to just get to know each other since January. It's been a long time, but as I was just saying that introduction, it occurred to me, and I just got goosebumps. The timing is so perfect. We are in this stage in my family where my grandmother is starting to transition. She's 97. She'll turn 98 in February. Yes. And her skin, what do we call it? Like glassy skin or whatever. She still looks so glassy. Um, but this has been one of her hardest weeks. Like she's been in bed all week and is starting to slow down in a big way.
Mm.
So, how did this topic get on our calendar for us to have a conversation about this week?
Week. Yeah.
It's when you go, but of course,
hmm Well, and it's also Halloween that we're
when the veil is like
Day
the
of the Dead.
thinnest
Yeah.
of, where it is, the thinnest of all year.
Right. So
Uh,
the timing is perfect.
yes.
Always is.
But I want to start about with your roots. Like, tell us how you got into this work, where you grew up, what inspires you. Give us a glimpse underneath the hood of who is Dr. Amy Robbins.
So I was born and raised in Chicago. Now I live in the city. I was born in the suburbs, and I had a pretty conventional life, like nothing spiritual, nothing. I mean, we were a traditionally more culturally Jewish, went to synagogue, had Shabbat, went to synagogue on the high holidays, had Shabbat, but like nothing did all the holidays, but nothing like overwhelmingly spiritual. I come from a very materialist background. My grandfather was a doctor, my uncle is a doctor, my father was a
Wow.
dentist, like very science-minded, science-based. And my mom actually, she raised us, and my grandmother went to school for social work, which I think is always so interesting because people always ask when I get to talking about my own intuition and connection, were they intuitive in the same way? Because
Mm.
usually sometimes you see that passed down. And they did not connect with the other side, but they were such intuitive women, like, still
Mm.
are. My mom is still extremely intuitive. She gets a sense for people, she understands them, she knows them. So it was always sort of there, but never talked about in these words. And then I went to college, and my freshman year, I had my first, what I call like out of order death. My aunt passed away. She was 48, the age I am now.
Wow.
And she
So
had
young.
so young. Like now, I'm being that age, I'm like, oh my God, I just can't. There's so
I'm
much.
47. Yeah.
Yeah, I feel like I've got like a whole other life that's literally just starting. And so it really shook me to my core. And it was one of those defining moments that I didn't realize at the time, but it shifted how I saw everything, how I saw the world, how I saw myself in the world, my drive to succeed. She and her husband had gotten divorced. and it caused a lot of financial strain for her. She did not have a
Mhm.
job outside the home, and so she ended up needing to go back to work at a job that wasn't really the best conditions for her illness, and so I think that the stress and everything, she just deteriorated pretty quickly after that, and she was waiting for a kidney and pancreas transplant, and when they went in to check her out to make sure, like, as she was moving up the list, they wanna make sure that you're gonna be able to withstand the transplant, and they realized that her heart wasn't gonna be strong enough to withstand the transplant, so they went in to do surgery on her heart to repair it, but when they went in, her heart was too damaged, and they actually
Wow.
couldn't yeah, they couldn't get her heart restarted. So she
Wow.
died in the hospital on the table. I got that dreaded call in college, like, she didn't make it through the surgery, which was not even I mean, it wasn't even on my radar that that was a
Right.
possibility. And so it just really kind of brought me to my knees, literally. And my mom and her were very, very close. I have a very close family. And so this was like losing a second mother to me.
Mhm.
And, there were a lot of things that happened after that that sort of became really difficult. My cousin he was very close to us, but he went through a very difficult time and became distant from the family, and I went right back to school, and so at that point, I was, in the throes of I was a freshman in college, everything was new, I was trying to figure it out, but over the course of 4 years, I really realized well, it actually wasn't until way after, but as I was getting ready to graduate, I had tremendous anxiety, and a lot of that anxiety was probably there before, but also I think a lot of it was this unprocessed grief and this pressure that I had put on myself having seen the trajectory of her life and how it played out, I had sort of made these connections in my own mind. I am never gonna end up like that. I'm never gonna
Mhm.
need to rely on someone else to support me to the point where I get to the point where, it could kill me. And so, when I was looking for jobs and everything, I was getting rejected over and over and over again, and I had my first panic attack. And I just remember getting, the final rejection letter and just kind of dropping to the floor in the kitchen of the house I lived in college, thinking, "Oh my god, like, I'm not gonna get a job, and I'm never gonna be able to support myself, and what is this gonna look like?" And then I did get a job. It was a job that I hated. I was selling radio airtime. It was a miserable job. And again, like that heaviness and that anxiety and frankly depression at that point set in because I was so out of alignment. I know you mentioned
Mhm.
alignment earlier.
Mhm.
I was living this life for what I thought it should look like. I needed to like climb the corporate ladder and initially I wanted to do consulting, but I didn't have the background for that. I had a background in psychology, but I did not want to go into psychology. And so I was at this job that I hated. I worked there for 6 months. I had a terrible boss, and I was like, "I'm just gonna quit," and I did, and I waited tables, and I lived at home, so I didn't have the overhead yet, luckily, and I volunteered at Children's what now is Lurie, but was Children's Memorial Hospital in their partial hospitalization program, and it was with kids who were stepping down from intensive outpatient therapy, and I loved it, and it felt meaningful, and I felt great about the work I was doing, and I was intellectually stimulated, which is a huge thing for me. And so at that point, I decided to go back to graduate school for clinical
Mhm.
psychology, and it was I mean, I went to University of Michigan, I had this, like, great degree from this great institution, and when I quit my job and waited tables, like, that was a huge, like, ego check for me. I really had to be honest with myself about, like, you could keep pushing forward in a job that you hate, or you can step back and you can do this and give yourself time to figure it out. And luckily, my parents were very supportive. And again, I didn't have many expenses at that point. So I was able to do it and save a lot of money and then go back to graduate school. So it was a
Wow.
really, I think it really is like one of those experiences where when your soul is literally crying out to you, you have two choices. One is to listen and one is to not. And
That is so beautiful. Here your aunt goes to the hospital in hopes of getting better, and you guys end up saying goodbye. and you begin to really get in full alignment with what really was meaningful to you. It'll also
My
be
greatest teacher. I mean, she was my greatest teacher here in a physical body from what I learned just watching her life. But since she's crossed over, she's been my greatest guide and teacher on the other side.
yeah. Well, that's what I was going to say. I can't wait to hear the stories since you're 48. And that was when she started a rebirth of her own. The stories of connections that you guys have during this year. It has to be so much fun.
Yeah, it's been people ask like how I still so let me back up and explain when I first experienced her across the veil.
Hey y'all, it's Terri. At Roots and Rebirth, we talk a lot about legacy, and salt is creating when we're celebrating. When you choose salt products, you're not only choosing sustainable period care, you're helping a girl stay in school through their Africa-based donations and education programs. Ring a bell? Maybe because I featured salt in 2018 on my blog, movementmakercollective.com. As Sherry, Salts Finder says, one menstrual cup can break the cycle of poverty for generations. And she means it. Join the movement. Go to salt.co and use Terri for 15% off because change starts here and it starts with you.
I actually had an experience in college, but I didn't realize that was it. And she came to me and she was her skin had been like really yellowed because of the pancreas, like her pancreas not working and her liver not functioning well. And so she didn't look particularly healthy when she was still alive. And in this visit, that's now what I know it is. She came to me and her skin was like vibrant and glowing. Like everything about her was glowing. And I remember she was wearing like a red sweater and she said to me, and she was on a golf course, which is symbolic because my mom is a golfer. That's like her happy place. And for years after my aunt's death, my mom couldn't golf. It was like,
Mm.
it was how her survivor's guilt in some ways manifested itself, which is comical because we don't necessarily think of things like that. But for her, it was really like she felt so tremendously guilty enjoying her life when her sister wasn't here anymore.
Mm.
And so I had this visit and she came to me and she said, I'm healed. Look at me. Look at how healed I am. And I
Wow.
thought, okay, that's nice. But again, I didn't know what it was. And honestly, this is how I know it's a visit is because I can still see it in my mind's eye. So
Mhm.
when people ask me how I can tell the difference between a dream and a visit, to me, a dream feels real and it's not that amalgamation of pieces, right? Like when I wake up from a dream, usually I can't even remember it 20 minutes after I wake up.
Yes.
But when I have a visit, it's very clear. So the second visit, which for a long time I thought was the first visit, but it's not, was when I was in graduate school. And it was right before my cousin's wedding. And my aunt came to me again. It's always in that like theta brain state when I wake up in the morning and then kind of drift back off to sleep. And she came to me and she said, there was an image of my mom standing at the kitchen sink in the house I grew up in. And my aunt said to me, tell her not to be upset. Let her know I'm going to be at the wedding. And then there was another image of my uncle.
Wow.
He was pushing a stroller while he was walking. And she said, tell him I hear him when he's out walking. I hear him talking to me. And so I remember like waking up. I remember my dog barking very loudly. And I turned to my husband and I said, Aunt Linda's here. Aunt Linda was just here. And he said, he was sort of like, what? Like he was out of it. And then when I fully woke up, I called my mom and I told her the story and she started crying and she said, I was standing at the kitchen sink last night and I was talking to Linda and I said, I can't believe you're not going to be here. I can't believe you're not going to be at the wedding.
Wow.
My
Oh my
uncle.
gosh.
Yeah. And then I called my uncle who remember is an orthopedic surgeon. So like this is not, and I shared with him, Aunt Linda told me to tell you she hears you when you're talking to her, when you're out pushing the stroller. And he said, that's when I talk to her, that when I'm out pushing the stroller. Now, this was not anything I could have known, But I had a professor in graduate school who I knew was interested in kind of indigenous healing practices. I didn't even know what indigenous healing practices were 25 years ago. And I went to her and I said, I had this experience and I don't really know what to make of it. And she said, I think you're opening up to something and I think you should keep going with it. It was something I
Wow.
mean, she and I are still in touch and it's something that she's always been really passionate about. And she said, here's the name of a medium. And she gave me a couple Sylvia Brown books because then that was all there was. There wasn't like, everyone who's a medium that's written a book right now. And I kind of put it to the side because I was like, second year of graduate school and I was getting ready. He wasn't my husband at the time of my first visit. He is now. But we were planning a wedding and I was in the throes of a diagnostic practicum, which is testing. And it's like all mind all the time. It's very, very analytical. And I was like, I don't have time for this. And so fast forward, God, it must have been 6, 7 years later, my papa died and the same thing happened. He came through with a
Mm.
message for my cousin who was getting married, information I wouldn't have known. I shared the message. And then again, was sort of like, put that aside. And then it happened with a patient, and I was getting
Wow.
messages, and I was like, all right, I need to figure out what to do with this. I need to figure out how to honor this. And so I sort of like tested the waters a little bit and just threw out the information I was getting without saying. So it was like kind of couched in a way. And she validated it. And so I thought, okay, there must be something. I mean, I didn't say like I'm hearing from I don't even want to, I always get worried because I don't want to reveal too much of a patient, but I said something like you know, did so and so like something and she was like, "Yes, yes." And so I knew I was onto something. And at that point, I reached out to the medium, the name that my professor had given me on that piece of paper 7, 8 years before, and started working with them and just started trying to develop my own intuitive abilities to see if there was a place where I wanted to move into mediumship completely. Did I just want to, you know, toy around with it? Like, what did I want this to look like?
Wow. That is a lot, you know, to go from not knowing what you want to do, to having options, but also getting clear messages
Yeah.
that your talents were beyond what you ever could imagine.
Yeah. And I think, it really does go back to this notion of like trust. Like for me, and I think that was something that because of what had happened to my aunt, I felt like I couldn't, like I needed so much control. I couldn't trust. I had to be gripping the wheel of life so tightly because if I didn't, the result was going to be like my end would be her end or her end would be
Yeah.
my end. And so I think that, in having had that experience with her, it so profoundly shifted how I viewed life, how I viewed death, how I viewed what happens when we die, how I viewed what happens when they die and their ability to stay connected to us. Like everything about it shifted my entire worldview. And so while I was in school and was practicing, when I went back to work with this medium, it was like, I can't quite unsee what I've already seen.
Yes.
What do I do about this? And what do I do about these intuitive hits that I get sometimes? Again, like I'm someone who I'm actually revisiting my medium practice now, like not as a seeing people, but just really working with a teach. I've worked with many teachers over the course of this time, but sometimes it kind of falls off. And my old teacher sadly passed away. So it's taken me a while to find someone new, but I go back and forth in it. I don't think I'm someone who is like a Laurel and Jackson who just gets this information all the time. But when I'm intentional about it, I can absolutely tap in. And I do have information that comes in sometimes in session. And I think it's just for me right now at this stage in my life, being really intentional about when I'm seeking that out and what that looks like. Because I want to be able
Yeah.
to trust it wholeheartedly.
No, we just dived right in, but we didn't just go
to read
to whoop,
to read.
well, and it's like from like just talking to like woo 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 woo. Like we went deep, And so I'm thinking about that viewer or listener who might, only know what a medium is from like Ghosts, like the movie with Patrick Swayze and Whoopi Goldberg. So if someone doesn't truly know what mediumship, intuitive, listener, like any of those terms, like how would you describe those things to them?
I would describe mediumship is the ability to connect with a discarnate being, so a being that's not in their physical body anymore. When I think of intuition, I think of the ability to connect to your own soul, your higher, people call it your higher self. I call it your soul. And to get really clear about those messages. And also we have intuition in connecting with other people all the time, right? We tap into or we feel into a sense of who they are. And this happens constantly. You walk into a room and you're like, ooh, that person feels a little chilly to me, or that energy I'm not sure I love, or I love that person's energy. They feel so warm and inviting, right? That's our intuition. We're tapping into a gut feeling about someone without thinking about without that filter that's processing. Oh, well, she's not nice because look at her face, or she's got RBF or whatever it is. You're just immediately tapping into what you feel in that moment before your brain kicks in and you start thinking about it.
Yeah, I love it. And I often think of my intuition, as part of like that inner compass that I have because I am connected to self in alignment with higher self and purpose.
Right.
And so it's like,
Voice, that inner
right. When you're making those decisions, do I take this job? Do I start this thing? It's just hearing it really clearly so that you know the answer is yes for you.
and it's always there and it's always right. And sometimes you might still choose not to listen to it. Like I have a number
True.
of times where I'm like, don't do this, don't do this, don't do this. And I'm like, but I really want to do this. And then I do it and I shouldn't have. But it's okay because it's still like there's still stuff that you can do to repair that usually. Not always, but usually. And, I also trust like that's part of my journey. And that's where free will, I think, comes in as well. Like we all have the free will that even when our soul is saying, do this, do this, do this, you can choose something else.
Mhm. So
You
tell us a
go.
little bit. Well, the girls morphing.
Right, right.
But tell us a little bit about your practice today.
So my practice today in many ways is still a traditional psychotherapy practice. However, I can't separate who I am in the room from who I am outside the room. And so much of the language I use and the principles that sort of undermine how I think about human growth and development and those big existential questions about what matters most in this world and what matters, how do we make meaning of our lives, I think is just embedded in the work that I do. And so it feels, I don't know that my clients wouldn't say like, oh, she's so spiritual in session, but it's woven subtly throughout everything I do, the language I use, how I talk about it. I mean, I talk about energy, right? And so that might be seen as very spiritual, but I also am very much about meeting the person where they are. So I do see a lot of professionals who are like, they know, because I have this podcast, they know that I have spoken to the dead, that I have that ability, and they don't want anything to do with that. Like, that is not their belief system, and I don't espouse my belief systems in therapy on other people. But they're like, "Mm-mm, we don't wanna know your podcast, we don't wanna listen to your podcast." I have a couple people who's like, "Your podcast popped up again," and I couldn't find the button, I needed to turn it off. Because for then I have to exist in the space of the therapy room, right? And I can
Yeah.
appreciate that. And there's other people who very much are want to talk about my recent episode and how it's impacted their life and how they think, how it makes them think about things. And they're interested in soul contracts or manifesting or energy work or whatever it is. And so that becomes a part of the work because that's what they want to do. But I also think spirituality in clinical work is a huge missing piece right now. And so the integration of it, even in just asking questions in an intake when you first see someone, will help guide maybe how me as a therapist will think about talking about those things. It's do they have a spiritual belief system that is non-religious, non-denominational? There's a lot of people who have religious trauma. And so when they hear spirituality, they sort of bristle because they think that means religion. It's a Venn diagram. There's an intersection of the two, but not necessarily. You don't have to be religious to be spiritual. Spiritual could be you're out in nature, you are in a meditation, you go on a plant medicine journey. Like any of those experiences, you take a walk with a friend. Any of those, you watch the birth of a child. Like any of those experiences can be profoundly spiritual because it's about this deep connection with something larger than yourself.
I love it. And all of that resonates with me. When I was considering divorce, I was speed dating therapists. There were a couple that I was visiting with to figure out like was one right for me. And I did settle on one therapist, and I ended up ending my sessions because around that same time I met an energetic shaman, and her work was what I needed. It really spoke to me and how, I guess, intuitively I knew I wanted to reconnect with my higher self. And so the one session with her was more than months of me speed dating therapists. Right. And so I love that you can subtly fit that in, so that people you can test drive, right? Because I didn't even know when I met the shaman that that was what I needed, but I knew that the therapists weren't right for me. And I think that would have allowed me to figure out what exactly I needed.
Yeah, and I think that when we're on precipices of big precipices, on the precipice
On that.
of on the precipice of a big life decision, right? It really is about our soul. And sometimes
That's a
it
whole word.
presents as anxiety or depression or sometimes we see people who go into manic episodes, go as far as psychotic episodes. And I'm not saying that all of those are crises of the soul, but a lot of them are. And if people who are listening today sort of look back at their lives, they can start to identify. For me, my crisis of the soul was being at this job that I hated, sitting in my car. I can tell you, I think I was like, well, one time I was in a parking lot of a mall because my job was to sell radio airtime. So I had to go to like these very obscure locations and ask some Radio Shack type business that was like barely holding it together to fork over a couple $1,000s for a radio ad between 2 and 5 in the morning. And so it was literally soul crushing. That job was soul crushing to me. And as a result of that, I became more depressed and more anxious. So, had I continued down that road, what likely would have happened was my depression would have worsened. Someone probably would have prescribed me some sort of antidepressant eventually. But the issue wasn't me. I mean, it was me if I wasn't listening, but the issue was I had put myself in a situation and in circumstances that felt very misaligned with my soul as a healer. And so I was able to luckily take a step back from that and say, this isn't working for me anymore. And so when we talk about like, there are some people who it seems like everything comes easy to and life just falls in line. It's like because they're aligned. They are doing what they were here to do. And there aren't those feelings of like, this doesn't feel right, but I'm going to keep pushing through it. And there are plenty of people who can push through a whole lot. But I can tell you, they too have crises of meaning. Like they come in my office, they're 60, 70 years old, and they're like, I built this whole life and it all feels meaningless.
Yeah. As you were laying that out, I just saw like avatars of friends and family just pop into my head. I'm like, oh my God, I need to send this to so and so, so and so, so. So as soon as this episode releases, and so for those people who will listen, what are the 3 steps that they need to take if they find themselves in a parking lot at work crying? Because we've all been there. I've been at a
Right.
TV station parking lot, not wanting to badge in.
Whatever.
Yes.
Like it's
What are those first?
first too. I remember like being with a guy in college and like kissing him. I don't know that I've ever shared this on a podcast. And then coming home and feeling nauseous. Like, okay, this has got to end. Like, I do not like this guy. So we're done. And it was like that quick. But again, we're so conditioned. Oh,
Yeah.
Don't pay attention. He's so nice, and everybody. He's so cute, and all the things. But that was my soul talking to me through my physical body.
Yeah. Yeah. Again, I can relate with that too. I've shared this once before on this podcast, but as I was getting my hair done on my wedding day, I heard a voice say, "Don't do it. You won't be happy." And I responded out loud, I'll be fine. I'm always fine. I'm a resilient being. I believe in faith and fortitude. And I do believe it was my grandmother, because she's come through in some reading saying that she's there to help me. But you're so right. Like we find ourselves in that place, but we are conditioned to just make it work. We are conditioned to just be okay. So if you find yourself there today, what are 3 steps that you can do, to begin to connect to self and take that first step forward?
Well, one is just noticing it. That's the big thing because and attend to it. Don't ignore that voice. And also don't freak out. You don't have to like throw everything away in that moment. But I think the first step is really to notice it and to take note and take note seriously about what that's saying. And I think, step 2 would be to really kind of I talk about the essence, like to get back to the essence of who you are. So
Mm,
think about a time when you were when you were aligned. And it might be back in childhood. It might be, you remember blowing bubbles and feeling free with the wind blowing through your hair. Like it doesn't it's not necessarily something that happened that you have like a really conscious memory of recently. And in that too is to think about what were sort of the traits at those times that felt really meaningful to you. Like I remember when I was 10 years old, we had a sleepover and with a bunch of girls, and it was like a daddy daughter thing. And I remember one of the girls, I don't know if she was homesick, but I remember feeling like I needed to take care of her, and I wanted to take care of her. Not that I needed to, but, like, I wanted to be there for her, and I wanted to help her and support her. And those things happened too, like, I was a peer helper in high school. Like, there were a lot of things that pointed to me being someone that could be with other people in their pain. And
mhm.
and so it's like looking back at your life, think about when those times have shown up for you because they've been there along the way. They're like people call them the breadcrumbs. I call them the lily pads. And when those lily pads popped up in your life, did you take them or did you take something else because someone else told you that's what you should take? And that when we
Yes.
can get back to that, we can get those lily pads to start popping up for us again, to start showing up for us again in the same way. Because I do believe that when you are aligned, that's what happens.
It's
I
magic.
did 3 steps.
No, that was the second. But
Okay.
when you start aligning those lily pads, it's like magic. Just the doors start opening,
Right.
you know? And I would say oh,
Oh,
go
go
ahead.
ahead. No, go ahead.
I was gonna say, and for the third, for me, as I think about how that resonated with my experiences in my life, it's, you know, just getting to that place where you no longer judge yourself. You're like, what I did before, It's not good. It's not bad. It's just what is. And now that I am connected, I can see things a little clearer. And, the most important thing for me to do is take, first micro steps, those first 3 micro steps to move forward and to take action. Because it's like you always get worked up and thinking about what is that first step to take because you want it to be so right and so perfect, but you just have to trust and believe that you're headed in the right direction.
Right. And that next lily pad will show up for you. And even if it doesn't, even it's not necessarily a direct line, but you can get your way across the pond eventually if you
Yeah,
just keep going. Mm.
that's so beautiful.
What you said, like give yourself grace. That's so important. I think people, I see it all the time in my clinical work, like they're so hard on themselves for the choices they made before they knew what they know now.
Yeah.
It's like, but you know something different now. As Maya Angelou always said to Oprah, when you know better, you do better.
Yeah, you do better.
And you do. And I see it over and over again. I mean, that's sort of the gift of what I get to do is I get to see people truly transform their lives. They come to me in a crisis that is, they're like, I don't think I'll ever be fill in the dot, whatever. I'll never not feel anxious. I feel like I'll always feel anxious or I'll always be depressed or I'll always be in this terrible relationship or I'll always hate my job to like very full, flourishing, beautiful, soul driven lives. Now, I don't know that they would say it's soul driven. I don't know that all of them would recognize
Right.
it,
Yeah.
but that's really what I'm helping them do.
It's so awesome. Now, you have mentioned, you've been working on a course. You mentioned that to me before we got started. And so I would love to hear what that course is about for therapists who are looking to be more aligned with their own souls, but also helping their patients find that spiritual alignment. Tell us about your course.
So I'm going to get there, but I just actually interviewed someone yesterday on my podcast, David Ross Marin. Hope I didn't butcher his name, Ross Marin, who's the director of the Spirituality and Mental Health Institute at Harvard.
Mm,
And
so cool.
there's one at Columbia, there's one at Harvard, they're starting one at Yale. And one of the things he said to me was that I'm hoping I'm going to quote this right. 60% of patients say that spirituality is a huge piece of their recovery, whether it's from depression,
Wow.
anxiety, eating
Wow.
disorders, addiction, whatever it is. 5% of therapists are trained, have ever taken any course in spirituality. So there is a huge hole in the clinical space. And if anybody is, wondering why we are in the mental health crisis that we are in right now, I have some thoughts on that. But I think we are in a spiritual crisis. We are in a crisis of meaning. We are in a crisis of being. And who are we? Who are we as individuals and who are we as a collective society in connection with other people? And so this course was for years. I knew it was what I wanted to do. I tried and tried and tried to think my way into what this course could look like. And I sat with Google Docs. I could not come up with the outline of this course. I have like multiple drafts of it. I was working with a partner for a little bit. That, we decided very amicably. She decided she wanted to do more mediumship. I decided I really wanted to do this. I was in the shower one day and boom,
Of course. Of course, always in the shower.
always in the shower. If I could live in the shower, like the things that I would know. And it just got downloaded to me and it was like, here's the modules. This is what they need to look like. And I started teaching it in the spring and it's in the summer and it's just growing. I mean, it's not like it hasn't blown up, but it's growing slowly. And the people that are coming are exactly the people that I want to be there because they are really thoughtful therapists who want to get more comfortable integrating spirituality into their clinical work. And I just feel like this is where the mental health space has to head. Suicide rates are higher than they've ever been. Mental health issues are going up, anxiety, depression, prescription medications. Something's not working. Like
Right.
something is not working. Right? If that was the case in any other area where everything was getting, if you were in a business and everything you were doing was making the business worse, you should be rethinking how you're running the business.
Amen.
That's what I think of with mental health. Like, we are not addressing the spiritual aspect of people. We are treating symptoms. We are treating their thinking and their behaviors, and we are not treating their soul.
And what do you say to parents as they're raising kids in today's society? Where are you pointing them to, the books or the advice on how to begin to shape their little ones to feel, to know their intuition, to feel spiritually aligned? I'm so curious, Dr. Robbins.
That's such a great question. I love Shafali Sabari's work, the conscious parent and the awakened family, I think, are her two books. I think, first of all, the work always begins with us. So much of how we are in the world, our fears, our wants, our wishes, are on all of those that tend to be unfulfilled in us can get projected onto our kids. So if you don't have the awareness of self, it's going to make parenting much more difficult, because my kids are my greatest spiritual teachers. And I can point to so many times, and they continue to be today. I mean, I'll have conversations and things will come out of my mouth and I'll be like, shut up. Like, why are you saying that? That is not the right thing to say. You know exactly what their response is going to be, but you still can't keep your mouth closed. But I know when my own stuff is getting stirred. And so I think that's the first thing, is to know yourself enough to know what's theirs and what's yours. And I think that's true in any relationship. We do so much projection because we get, I hate the word triggered, but like a button gets pushed in us that's our own unconscious from our childhood or maybe past lives or whatever it is. And we respond from that place, not from the place of what is actually happening in that moment.
Yeah.
I think the other thing is about connection. Family
Mm.
dinners are nil. No one sits down for family dinners anymore. Everybody's running from one thing to the next to the next. Those family dinners are time for meaningful connection, to have conversations, to hear about the day, for your child to feel like they matter, because we know mattering is a huge predictor of, like, I always get like backwards jumbled in my head. If a child feels like they matter, there's a less likelihood for anxiety, depression,
Wow.
substance use. It's that feeling like someone at the end of the day is there to say, how was your day? Let's talk about it. Let's sit down for a dinner together, put the phones aside, and let's just be present. Watch a movie. Like, they're simple things. They're not difficult. They don't cost anything, but
Yeah.
we don't do them anymore. We've lost that. And until we are able to bring ourselves back to that place, we're constantly ushering our kids, shuffling them from activity to activity to activity, which is a soapbox you don't want me on, because I will go off. And that doesn't allow for real connection. Sometimes in a car it does. I also think if you can get your kids to be captive, trapped audiences, that's also a good time to connect, because that's
Oh.
talk without you giving them a barrage of questions.
You have so many like words of wisdom. This has been so much fun. I have a question for you, for the person who is thinking about mediumship, who's thinking that they might want to do this type of work. We started the conversation today with that. And you mentioned that you've studied with different teachers, and you tell them where they should start if they're curious.
Hey friends, it's Terri. You heard me say that transformation comes from both roots and rebirth. And sometimes that means finding light in our hardest moments. That's why I'm loving Lumankind's Light Through Lost Mindful Mark Pack. These wearable reminders allow you to set an intention that will help you center, reflect, and rise. Treat yourself or someone you love. Go to lumankind.com and use code Terri15 for 15% off your first purchase. Because even in loss, light finds a way.
I mean, ask around, and I think just find someone whose work resonates with you.
Mhm.
So, I mean, there's a lot of people out there. There's a lot of people teaching. I think you want to get a sense for their authenticity, for their integrity in the work. There's a lot of not great mediums out there who are willing to hang a shingle, and I
Yeah.
think integrity for me is always like at the forefront. And so, that look on like Forever Family Foundation, I love. They certify mediums. A lot of those mediums may teach courses as well, but really being clear on, is this person someone that feels authentic to me? If a medium is willing to see someone, 5 or 6 times in a year, probably not a great medium, because you're really supposed to allow people. I mean, people need to integrate the experience. They can't use mediumship as a spiritual bypass. And so
Mhm.
usually people who've lost someone, they want to connect with them. You shouldn't be going multiple times a year. You can cultivate that connection on your own, and you have to work through the grief of that loss. If you're consulting a psychic, why aren't you turning and listening to your own inner voice? Why can't you do
Mm.
that? So it's really, I'm all for these treatment modalities. I think they can be really powerful, and it's particularly really powerful when they're integrated with therapy, because you can go to a medium reading, and your loved one can come through and share information with you. And then you can bring that back to, hopefully one day, your spiritually informed therapist who will who will be open to you talking about that and taking that experience and integrating that. I mean, in the psychedelic space, everything is about integration, integration, integration.
Yes.
You're integrating for most people a really profound spiritual experience.
I love it.
So we should be
Yeah.
doing that with all these experiences.
So for the person who wants more of you and to learn more about your work, your book, your podcast, how can they follow you?
Oh, thank you. My podcast is Life, Death, and the Space Between. It is a massive library at this point. I think I have over 450 episodes.
Wow.
Yeah, it's crazy. I'm like, how did this happen 6 years later? So that there, you can follow me on Instagram, Dr. Amy Robbins. My website, if you want to get on my email list, there you can see all the different courses. I have a retreat coming up actually near you in Austin.
Yes.
I do with a girlfriend who's a yoga instructor. She's excellent at understanding the body. And so it's just a beautiful combination. I think most retreats tend to be more just yoga. And this really integrates body and soul. So I've got that coming up, just so many things. And I appreciate that you said my book, because we're putting it out there that there will be a book.
I don't know why I thought there was a book, but let's make it happen. Maybe that's my intuition talking.
I hope it is. I hope it is. I just actually turned in my chapter last night. I'm still working on my proposal. So a rewrite of a proposal. So we're putting it out there that it's going to happen.
Yes.
Hopefully it will.
Let's claim it for you. This time next year, we're going to be talking about your release
I
date.
hope so. I hope so, from your lips.
Thank you so much for just sharing your knowledge, your light, and just giving us insight as to, how we can hold multiple things in our hands. We can hold a therapist book, a little bit of spirituality, but we can also hold the tools that we need so that we can be more spiritually aligned and just walking each day with our soul's purpose first. This has been so much fun.
Thank you, Terri. I'm so, so glad. Finally.
I know. I'm going to see you in Austin at this retreat in March.
So I hope so.
Don't forget to subscribe and follow this podcast. You can find me at all things Terri Broussard Williams and movementmakercollective.com. Hey, y'all. Hey, now you know all this stuff, but before I go, a reminder, the content shared on this podcast is for informational and educational purposes only, and should not be considered professional advice. Okay, that's right. I am no professional. If you need a medical, mental health, or other professional support, please consult a qualified expert. Till next time, I'm cheering you on.